Logical correction of contour changes of the face is based on an understanding its structure and the process involved in the aging appearance. The aging changes are seen at all tissue levels between the skin and bone, although the relative contribution of each component to the overall change of facial appearance has yet to be satisfactorily determined. Understanding the aging process and how each different component, skin, muscle, fat, bones, is modified and or altered by the aging process allows the practitioners to specifically design the best combined treatments to achieve optimum results. So can we stop the aging clock? Unfortunately, we can't. We have to address the aging process properly, assessing the patient's face, and determine what changes need to be corrected. Then, properly applying the integrated approach we call the 4 Rs or facial rejuvenation to ameliorate the aging process. The aging process is a complex synergy of skin textural changes and loss of facial volume. Gravity, subcutaneous fat redistribution and volume loss, skeletal remodeling, hormonal imbalance, chronic solar exposure, and smoking are the most contributing factor to the aging process. Chronic UV damage and free radicals cause skin textural changes and dyschromia. Expressive facial muscles cause the skin wrinkling. Volume loss of the subcutaneous fat with fat redistribution cause contour irregularities. Remodeling of the underlying bony and cartilaginous structure causes facial silhouette changes. Loss of elasticity of the skin and underlying tissue cause lines to be increased and to become permanent. Gravitational changes from the loss of the elasticities of the soft tissue and suspending ligament along with the fat volume loss cause ptosis of the tissues. So these factors mentioned in this slides are the contributing factors in the changes that happen during the aging process, eventually causing asymmetry and loss of harmony. As we discussed earlier in the course, the face can be divided into 3 horizontal sections called the aesthetic zones of the face. These consist of the upper, middle, and lower thirds. In a young person, there's a near perfect proportion between these 3 zones. Elongation of the upper third of the face is a consequence of hypertrophy of fat, bone, and cartilaginous tissue, along with ptosis of the soft tissues. In addition, expressive facial muscles and their influence on the skin, along with the loss of subcutaneous fat and fat redistribution, causes further morphological changes. The middle third of the face appears to shrink due to loss of subcutaneous fat with fat redistribution, gravitational changes from the loss of elasticity of the soft tissues and supporting ligaments, and remodeling of the underlying bony and cartilaginous structures. In the lower third, there's a reduction in the height because of loss of the mandibular and maxillary bone structures, thinning of the skin and subcutaneous fat tissues, as well as an increase in the width because of the ptosis of the middle third of the face. This slide represents the typical changes which occur during the aging process. Please note the deflation of the facial volume in general, ptosis of the eyelids and temporal wasting along with fat herniation of the suborbital area, thickening of the nasolabial fold and the malleolabial folds, Also noted is the significant heaviness of the lower face and contour irregularities. Some of my patients who come to me call it a bulldog look. In this slide, please note the facial evolutional changes that occur during the aging process. You'd see a significant hollowness and deflation of the face volume, causing the significant ptosis and the tired look. So the primary event of the aging process is a loss of facial volume and the resulting involution and eventual descent of the soft tissues. In the young face, the subcutaneous fat deposits marked in yellow are masked by the fullness provided by the extracellular colloidal fluids marked in purple. With advancing age, progressive loss of facial fullness causes the subcutaneous fat deposits and underlying soft tissue and skeletal structures to become more evident, as seen in the center photo of the old face. Involutional exposure of fat deposits in the jowl and chin gives the impression of descent, seen in the right photo of the older woman face. The laxity of the retaining ligaments of the face contribute to the ptosis of the tissues. On the right picture, you see the false retaining ligaments of the superficial musculoskeletal aponeurotic system, or called the SMAS. In this slide, we could see the retaining true ligaments attaching the soft tissue to the bone. Skeletal remodeling due to bone loss plays a significant role in the aging process. The 3D CT scan of the middle face of an aging person shows the alveolar bone loss, flattening of the malar eminence, increase in the piriform aperture, orbital rim loss, and clockwise rotation of the midface. The aging process affects all layers of the face from the skin down to the bone. In this slide, we could see the superficial fat compartments along with the subcutaneous fat, which are both affected by the aging process. The left half of the face shows the following: the glabellar fat pad, the suborbicularis oculi fat or SOOF, cheek fat, and submental fat compartments. These are part of the deep fat compartments that are also affected by the aging process. Looking at the aging face, we could see abrupt discrete changes between fat compartments, which play a role in the aging process and the contour irregularities. Please note that fat compartments age independently. Volume loss in one area causes folds in the adjacent areas, or pseudoptosis, or a domino effect. Due to the fact that those distinct superficial and deep fat compartments are unable to flow past their respective septal boundaries or retained ligaments, which create an irregular contouring of the aging face. In the aging process, the connective tissue starts to loosen and fat usually diminishes. Injecting dermal fillers in the fat compartments, which the retained ligament separates, allow us, in case there's no enough elastosis, to restore the lost features from youth, but reconstruction needs to be done carefully. So let's hear about few lexicons or medical terminology related to the aging process. We could see the nasolabial fold, the groove medial to it, some wrinkling or vertical lines along the upper border of the lip, the mouth commissure droopiness, a groove, and the jowls. This is very good demonstration of the changes that happen during the aging process, showing the dynamic relationship between the fat compartments. The green areas marked are where the fat compartment lose volume due to fat hypertrophy. These include the temporal and supraorbital depression, the tear trough, the nasojugal groove, the medial cheek fat pad, the precanine fossa, the buccal, and the labiomental depression. Where the pink marked areas, the pink marked areas represent the fat compartments where there's a volume increase due to fat hypertrophy. These include the malar mound, the nasolabial fold, the mediolabial fold, and the jowls area. Our goal of facial beautification is reestablishing a balanced distribution between the superficial and deep fat to eliminate contour irregularities. This is a very good demonstration of the changes of facial shape due to volume loss. Let's take a look at the rope that is filled with a fluffy material. On the left, we look at points A, C, and B, where C represent a midpoint between A and B. On the right, we have emptied the rope from the fluffy material. Let's look again at the slide. On the right side, it appears that AB became longer, it got elongated, and C has dropped down. In reality, if we measure the distance between A and B on the right and A and B on the left, they're going to be exactly the same. C definitely had dropped down. All of those changes occur because of the emptying of the inside of the rope or the volume loss that occurred inside the rope. This is exactly what happens with the aging process, where the face became elongated like A and B, and the tissue become ptotic like in C. So aging is an evolution of shape due to volume loss. You could see in this photo the changes that occur during the aging process: change in shape, contour irregularities, and deflation. So let's go over the aging process from being a baby all the way to becoming a very old person. You see, when we're kids, the face is full of fat, it's like a balloon. The shape of the face during our teen years, it stays still like a balloon. It's full because of lots of fat contents. In the late 20s, the balloon-shaped face starts to deflate. Once we hit the mid-30s to late 30s, as the balloon continues to deflate, our face shape becomes triangular. This is what we call it a triangle of beauty, where the triangle base is at the top of the head, around the forehead area, and the tip is pointed towards the chin. This is the most ideal shape that most people love to have. Another demonstration of the triangular shape or the triangle of beauty in a man. As we reach our mid-40s, our facial shape becomes squarish. In particular with women, when the face becomes squarish with dominance of the lower face, it gives them a masculinized look. To mid-50s, the facial shape transfers from being squarish to an inverted triangle, where the base is at the lower face and the tip pointing upwards toward the frontal area. As an aesthetic practitioner, your goal is to achieve natural corrections that fit into the respective facial dimensions. Creating balloon heads by augmenting all compartments is possible, but is not desirable.